We are. Welcome everyone to today's recorded webinar, Updates on Youth Mental Health Services in Ohio, with our presenters today, Liz Henrich and Elijah Jones from the Ohio Association of County Behavioral Health Authorities. This webinar is co-sponsored by the Great Lakes MHTTC and SAMHSA. The Great Lakes ATTC, MHTTC, and PTTC are funded by the Substance Abuse and Mental Health Services Administration Cooperative Agreements. The content and views in this training are those of the speakers and do not necessarily reflect the views of SAMHSA and the Department of Health and Human Services. The network believes in using affirming, respectful, and recovery-oriented language in all activities. For more information on upcoming events, please follow the Great Lakes MHTTC on social media or visit their website. Thank you for joining us today. This webinar is being recorded, so we will not be offering continuing education units. And here is a little bit about our presenters today. You can pause this and read this. I won't be reading this verbatim. And now we'll switch over to Liz, who will be starting this presentation off for us. Thank you, Liz.
Thanks, Elijah. As he swaps the presentations here, I will give you a little update on what we're going to do today. We are going to provide a quick update on some youth mental health services and activities in Ohio. Throughout today's presentation, we're going to hit on 4 main topics. We're going to hit each of these at a pretty high level, but provide you with some links and resources for where to go on each topic if you want to dive deeper and get some more information. So we're going to start with the Ohio RISE program. The Ohio RISE program stands for Resiliency Through Integrated Systems and Excellence. This is a program in the Department of Medicaid in partnership with some other agencies where the state is really focusing on providing some additional services and supports to youth with complex behavioral health and multi-system needs. So Ohio RISE is operated under the Department of Medicaid with a specialized managed care program that focuses specifically on some of the children and youth that have complex, chronic, multi-system needs. Through this program and the Department of Medicaid, the youth can access a series of substance use disorder care, mental health services, and a few new services that are coming online with Ohio RISE. And that includes intensive and moderate care coordination, improved intensive home-based treatment, behavioral health respite care, primary flex funds used to meet additional needs that youth and families can have when these complex needs are in place, mobile response and stabilization services. We'll dive a little deeper in on that service next. And in-state psychiatric residential treatment facilities. This service is going to be coming online or launching next year, but the work is underway now to develop the protocols and the policies related to psychiatric residential treatment facilities. So the Ohio RISE program has been under development for a couple of years now. A lot of planning work went into this from the Department of Medicaid, along with other state agencies that interact with the same youth that we're serving. So there is a shared governance model at the state level. The focus is on coordinating and integrating care and services by bringing together local entities, schools, providers, health plans, families, and others, including local ADAM boards. The ultimate goal of Ohio RISE is to prevent custody relinquishment and provide more integrated and quality care to the youth in need of these services. So we'll talk a little bit more about enrollment and some of the services available in future slides. You can see a bit of a preview here. As we go to the next slide, the Ohio RISE managed care plan that has been selected after a competitive bid process is Aetna Better Health of Ohio. Ohio RISE is a program launched on July 1 of 2022. And as of early August, which is when we're recording this, just about 7,000 youth have been enrolled, and there's work underway to continue enrolling youth throughout Ohio. So we're gonna play a short video now that gives you an overview of the development of Ohio RISE and sort of the initiation of the program and how it came about.
Hi there. Ohio Medicaid's managed care procurement began with a bold new vision to focus on the individual rather than the business of managed care. ODM wants to do better for the people it serves. Ohio Rise, Resilience Through Integrated Systems and Excellence, is a specialized managed care program that will provide behavioral health services to youth with complex behavioral health and multi-system needs. You may be wondering what services are included in the Ohio Rise program. Ohio Rise will provide intensive and moderate care coordination, intensive home-based treatment, psychiatric residential treatment facilities, mobile response and stabilization services, behavioral health respite, and primary flex funds. These services are in addition to existing community behavioral health services and other outpatient and inpatient hospital behavioral health services. Together, these services will provide care for youth who need the most coordinated approach for supporting their complex multi-system needs. All Ohio Rise care coordination involves team-based service planning and evidence-based care through a coordinated approach, leveraging natural supports such as their family and community, with the youth and their caregivers at the center of a highly individualized plan of care. Care coordination will be delivered in 3 tiers, and the 2 most intensive tiers, called intensive and moderate care coordination, will be delivered by community providers called Care Management Entities, or CMEs. Ohio Rise's intensive home-based treatment service will provide comprehensive behavioral health services in a home-based setting such as a youth's family, home, school, or community. Ohio Rise will also provide in-state psychiatric residential treatment facility services beginning in 2023. PRTFs will provide high-quality inpatient-level services in a residential setting. This service will help serve youth with the most complex behavioral needs closer to their families and support networks, as well as prepare them to return to a lower level of treatment or family-based care setting. Mobile response and stabilization services will also be available through Ohio Rise. MRSS provides youth and families in crisis immediate behavioral health care and early intervention to help avoid hospital admissions or other out-of-home placements. MRSS will be built upon the existing service provided by the Ohio Department of Mental Health and Addiction Services, and will also be available to children not enrolled in Ohio Rise. Ohio Rise's Behavioral Health Respite Service will provide a short-term, temporary relief to the primary caregiver or caregivers of an Ohio Rise Plan enrolled youth. This supports and preserves the primary caregiving relationship. The 6th service that Ohio Rise will offer is Primary Flex Funds. Primary Flex Funds support services, equipment, or supplies to reduce the need for other Medicaid services, keep the child or their family safe in their home, or promote the youth's opportunities for full participation in the community. These 6 services, along with all of the other behavioral health services covered by Ohio Medicaid, will be provided through a collaborative delivery system across Aetna Better Health of Ohio, the Ohio Rise Plan, state agencies and community partners, regional care management entities, behavioral health service providers, and the Ohio Department of Medicaid managed care organizations. Ultimately, the system of care supported by the Ohio Rise program will give youth a chance at a bright future and will help ODM do better for the people it serves. For more information about the Ohio Rise program, visit the Ohio Rise webpage on the Ohio Medicaid Managed Care website. You can also contact us at ohiorise@medicaid.ohio.gov.
So that video provides a good overview of what the Ohio Rise program is. We're going to spend just a couple of minutes digging in on 2 specific areas. And one of those is going to be the eligibility. So in order to be eligible for Ohio Rise in Ohio, you do have to be a youth that is eligible for Medicaid, either through managed care or a fee for service. between the ages of 0 and 20, so youth is defined as 20 for this program, and require significant behavioral health treatment measured by the Ohio Child and Adolescent Needs and Strengths Assessment, otherwise known as the CANS assessment. So the CANS assessment is a key feature of the Ohio RISE program and eligibility, and also determination of which level of care coordination an individual might need as a result of this assessment. So as Ohio RISE was coming on board, there was also a significant effort to train people throughout Ohio to be able to administer the CANS assessment. So each of the managed care organizations have people that can administer the CANS. Aetna Better Health of Ohio has people that can. The local care management entities all have staff that can administer the CANS assessment. You can identify somebody through the Medicaid Consumer Hotline, and many local behavioral health providers and Family and Children First councils all have individuals that can be CANS assessors on site, and or they can point you to one. So if you have a youth and you think that they may be eligible for Ohio RISE and benefit from those services, the CANS assessment is a step that's needed in order to move in that direction. Some children and youth may also be eligible for Ohio RISE due to certain urgent conditions. For example, if they're in the hospital for behavioral health reasons, there is also a waiver component of this so that Medicaid eligibility can be expanded a little further to meet specific and urgent needs. The next section we're going to dig in a little bit on is those care management entities. So the care management entities serve a critical role in the Ohio RISE program, as they're the entity that's kind of on the ground in each area, and they have a responsibility for delivering some wraparound care in that model for the catchment area. You can see the map here. It's a little tough to read on this slide, but we'll make these slides available, and you can see that there is a link that you can go directly to the map to find the care management entity in your area of the state and how to get in touch with them. The CMEs are going to be charged with delivering wraparound driven care coordination and to build out and connect community resources for the youths and families that are going to be enrolled in the Ohio RISE program. So that is the Ohio RISE program at a high level overview. There are good resources both on the Department of Medicaid site and Aetna Better Health of Ohio if you're looking for more information about the program or insight as to how to access the services for somebody that you're working with as well. The next service that we're going to dive in a little deeper on is Mobile Response and Stabilization Service, also known as MRSS. The reason we're going to spend a little bit of time here is because MRSS is one of the signature services of Ohio RISE, but as MRSS is built out in communities throughout Ohio, it's available for any child or youth in crisis, not specifically those that are Medicaid eligible. So MRSS by design is a rapid mobile response and stabilization service for young people who are experiencing significant behavioral health or emotional distress in their families. So it's a crisis service for young people. The design is that it's available 24 hours a day, 365. It's delivered face-to-face where the youth are in their home, school, maybe an emergency department, or another location in the community. The purpose is to help families and youth build the needed skills to ensure that the future distress is less frequent, less intense, and that tools are provided for where families can access additional care. There are stages within the MRSS program design that are triage and screening to help identify what the level of need is, a mobile response if it's necessary for individuals to come to where the youth is in this crisis, and stabilization. The interventions are designed to make sure that the current living environment is sufficient for the needs of the child, that they can stabilize the behavioral health needs, improve functioning, and again, connect with additional service if that's necessary as well. So if we can go to the next slide, we can talk a little bit about some of the major tenets of MRSS. As this service is designed, it is the child and the family that defines the crisis, not the professionals. The distress of a young person can impact the full family system, not just the child, and MRSS uses that family systems approach to try and make sure that everyone receives a response. Services are trauma-informed, culturally responsive, family-driven, and youth-guided. The activities, services, and supports in the skill development are individualized to meet the needs in each unique scenario and to meet the preferences of that youth and family. Youth and parent peer supports are very important components of the MRSS team. It's always helpful to have somebody that has gone this path before that can help guide a youth and a parent through what they're going through. They can use their lived experience to help others understand the pathway. And MRSS has a planning and linkage focus to kind of connect and partner with the youth and other family supports and community supports or system supports to ensure that the response that's provided in the immediacy of the crisis is also connecting to further supports, further services, further care. MRSS is designed to be 24/7 and available on call as needed in communities. So the core components, I'll keep saying this, it's a 24/7 response. This is one of the biggest benefits and also one of the biggest challenges of building an MRSS team in community. It is family driven. That crisis is not determined by professionals that interact with the youth and family in any setting. It is driven by what the family needs and where the family needs a response. It is built on the principles of a system of care model that is bringing the teams of the systems that are responding into play in order to build out the most appropriate response. There is a mobile response feature. Not all of our crisis systems and crisis services go to the individuals. The MRSS system by design is mobile and is responding where the youth are, with a focus on initial de-escalation and safety planning, and then ongoing connections to services and supports and stabilization. Again, that youth and parent peer support is key so that there are others involved that can help, and also to make the facilitated linkages and connections. The MRSS team itself will not be providing ongoing long-term care, but they can make connections to those that are and provide insights into what may be needed for the young person. So then the triage response levels, there's a structure in place for this. And some of the calls that come in for MRSS may just be seeking information and referral. It may not require an immediate response in an immediate crisis, but it could be asking, what do I do if there is an emergency, and providing that information? How do I get in contact with an agency for needed care and provide that information? So there's information and referral. There is also a structure for a non-immediate response that could be a family-driven response where you can get more supports in play, or requesting a scheduled appointment at some future time. There can also be an immediate response that requires an immediate action to provide a diagnostic impression to a response team that can respond to a high degree of distress that is not all the way at that emergent level. And then the final triage is there is an emergency, and the emergency demonstrates substantial risk of harm to self or harm to others. And that individual needs a response right now. And that may be that 911 is called, and there's also an emergency services response. The MRSS team also gets dispatched to help with de-escalation and stabilization in that scenario. And the MRSS team has a responsibility for following up once the life-threatening situation has been stabilized to provide ongoing connections and support for that youth and families. I think the landscape in Ohio right now is that MRSS is still a developing service. It is not available in every Ohio community or in every Ohio county. As of this recording, MRSS is available in about half of the counties and serving a number of areas. There are efforts underway to continue to bring more MRSS sites online, and the Ohio RISE program is helping to encourage more communities to stand up MRSS teams. There's also an MRSS call center that launched in July of this year, and the call center can be accessed using that number that's on your screen there. They can help refer, they can help connect to those MRSS programs, and they are keeping track of when new programs come online, how to access them, how to connect families to them. So it's that phone number allows for a single point of entry and a single point of access for youth and families or others wherever you are in the state to be able to make one call to figure out how to connect with MRSS in your area. And the last thing we have there are a couple more of resources if you want to learn more about MRSS. The Department of Mental Health and Addiction Services is the entity that certifies the MRSS teams and the programs, and they're really working to build out more. Wraparound Ohio has a whole focus on MRSS. Some of the things that you've seen on previous slides, we borrowed from them. And the toolkit that kind of spells out the different details of bringing an MRSS program up and what that needs to look like in your community. So that's MRSS, and I think I'm going to hand it over to Elijah to talk a little bit about 988.
Great. Thank you. Thank you so much, Liz. Um, we're going to transition to kind of two services that are really for anybody. They're national services. This 988 line launched July 16th of this year. So lots of new developments in July around crisis services. And you can kind of see our state taking a vested interest in improving crisis response for everyone, but particularly children and youth. So 988 is a national suicide and crisis lifeline. It's replacing the National Suicide Prevention Lifeline. And it offers 988 offers 24/7 access to trained crisis counselors who can help people experiencing mental health related distress, which could look like thoughts of suicide. It could be something around mental health or substance use crisis, or any kind of emotional distress. 988 is there for people to contact. People can dial the number, or they can text it. The families can also utilize 998 if they want to call in, get support if they're worried about a loved one. So 988, as I said, it is replacing the National Suicide Line. And in Ohio, there are several call centers. You can see on this map, those call centers are starred. So not every county has their own call center. You can kind of see where those calls are routed to. I think it's important to note that these call centers are able to help the caller, whether that be an individual or family, try to find resources that are local to their community. That's the intent of these lifelines. So as I said, they're available 24/7, and they're there to help people access services that are local to them. Now, there is a difference between a mental health and addiction emergency and a mental health and addiction crisis. So this infograph was developed by the Ohio Department of Mental Health and Addiction Services, and I think it does a good job differentiating when someone should call 911 and when someone should call 988. So examples of a mental health and addiction emergency might be someone who's actively uh, suicidal and making threats of suicide. They might be threatening harm to self or others. There might be an apparent drug overdose. Those are definitely times you want to call 911 for some immediate on-site intervention. Other times when it might be appropriate to call 988 are for those more of those crises. It's about an individual might be talking about suicide or planning to self-harm. They might be talking about harming others. They might overuse alcohol or other drugs, or there might be some extreme depression, anxiety, or some other mental health symptoms that they're um, experiencing. So that's a little bit of difference between when to call 911 and when to call 988. So Ohio is doing a lot of work in really building up and enhancing our crisis system. And 988, the implementation of 988 is part of that plan. The state's crisis system is being built around this connect, respond, stabilize, and thrive, in an effort to really create a full continuum of care around crisis that'll meet people's needs. This national rollout of this line has been coming for a while now, and the local alcohol, drug addiction, and mental health services boards aren't getting away with their current crisis lines during the transition period. There, there is concern that people might not know about 988 and still call the line they've known for a long time. So at this time, those local lines are still up and running. So an individual family can call their local number, or call that 988 number. If you are interested in learning more about the crisis services available in your particular community, we encourage you to reach out to your ADAM board to see kind of what that line is that's being funded, or other crisis services that are available in your particular area. Another resource that AWACPA's been promoting for a long time now is the crisis text line. The crisis text line provides free 24/7 high quality text-based mental health support and crisis intervention by empowering a community of trained volunteers to support people in their moments of needs. This service is free to anyone at any time. Although it's not a substitute for therapy or counseling, it does provide people a resource to connect with someone who's trained, who can help move people from a hot moment to a cool and calm place and help them create a plan to stay safe and feel better. This is an amazing resource for anyone, but particularly youth who are really uh, um, into texting and prefer texting over calling. We have a little video to show developed by the crisis text line to give a little bit of information about this service.
To see ourselves in each other, to find compassion and understanding and gratitude and grace. People need empathy. Families need empathy. Communities need empathy. At Crisis Text Line, we're powered by 10,000 people who are ready to show you empathy whenever you're feeling alone, who are there to see you and hear you and validate you and remind you that the world needs you.
So the crisis text line is such an important resource because it's not just when there is that emergency level, or if someone's talking about harming themselves or other people. It can just be for emotional support. You saw that text in the video that said, I just need to talk to someone. And it can be as simple as that. Someone can reach out to this line, the crisis text line, just to get some emotional support to make it through to the maybe when they have someone else to talk to, or they go to their next appointment, or that trained counselor might provide some resources for that person to look into after they're done with the conversation. But how do you use the line? It's pretty simple. In Ohio, we have a particular code. We text the national line that routes that text to Ohio counselors, but you text for HOPE to 741741 24/7 about any type of crisis, and a live trained crisis counselor will respond to that text within 5 minutes. The crisis counselor will help move from that hot moment to a cool calm. So that number is for HOPE to 741741. You know, these are two great resources that can really support students and families. And as we think about this next academic year coming up, and you know, as Ohio seeks to improve those crisis services, these two numbers, 988 and the crisis text line, can really be a great resources for people. So we want to thank you for attending today's recorded webinar. As we've said, we gave a lot of information. So the PowerPoint will be made available for future reference if you want to, you know, get those numbers down. Remember 988, text for HOPE. You want to look up those links about Ohio Rise and MRSS services. So those will all be available on this PowerPoint, which will be posted. So thank you again for attending, and we wish you much success in this upcoming academic year.